Welcome back to Community Update. I am your host, Promise Okoy. Recent research has found that the activity of certain genes in our body changes with the seasons. Whether the temperature is too hot, too cold, or just right, our bodies respond in different ways. The flu, heart attacks, diabetes diagnosis, depression, and other ailments are all more common in the winter months. In our community, we are beginning to see some of these changes, and that's why we decided to bring a health practitioner to share with us some helpful tips as we get ready for the winter months. Dr. Agnes Chinelo Iwebu is a UK-trained family physician with full license to practice family medicine here in Nova Scotia. Thank you so much, Doctor, for coming to the show.
Thank you for having me.
Interestingly, the winter is here, and you can feel it. And we're beginning to have people prepare themselves for it. But beyond that, we're beginning to hear RSV. Tell us, what is this all about? And give us a sense of how we can best protect ourselves against it.
Absolutely. Thank you for that question. So RSV stands for respiratory syncytial virus. It's a viral infection that affects the breathing passages and the lungs. It causes common cold symptoms, and most people would recover within 1 to 2 weeks. However, we have the at-risk category group: babies less than 6 months of age, toddlers, children less than 2 years of age, or older adults 65 and above who may have underlying health conditions or weakened immunity that may predispose them to more serious symptoms that may require urgent medical attention.
Right.
In terms of how you can protect yourself, I think we need to know how the virus spreads, which is via person-to-person contact.
Right.
If someone has RSV and coughs and sneezes, the droplets, the germs are in the droplets, which can spread on surfaces.
Right.
Therefore, we need to, if we have somebody comes in contact with those surfaces and touches their face, their hands, nose, and mouth, they may be exposed to the germs, to the virus. Therefore, we need to wash our hand, which brings me to the first prevention tip, which is wash your hand. Wash your hand with water and with soap. If you don't have access to water or soap, and soap, then hand sanitizer. Also, if someone is infected with RSV, then it's best to cough into your sleeves or use tissue, and after that please discard the tissue and wash your hand, because there's no point if you've discarded the tissue without washing your hand. Your hands is still infected with the germs, so hand washing.
Right.
The next thing is those surfaces I talked about, so disinfect the surfaces. Right. If one is ill, please don't go to work because you're exposing your colleagues at work. And also, if your child is ill, same thing, don't send your child to daycare or to school. Likewise, they're going to, risk of exposure to other children as well. Right. And then, in general, stay away from people that are sick, because you're exposing yourself.
Exposing yourself, yes. Yeah. But so while you were talking, you mentioned that demographic, the children in particular, this case. It's actually disturbing to hear or to see that it's really surging high, and they are most affected, and of course the elderly. How can we know what symptoms are, and then what do parents do in the event where they begin to observe things that are unusual around their children?
Absolutely.
Yeah.
So children have the tiniest of the airways, right? And RSV now inflames the airway passages, therefore making breathing really difficult. And the symptoms usually are runny nose, fever, coughing, which can progress to wheezing and shortness of breath. There'll be refusal. Some kids might refuse feeds or fluids, and reduced activity. They might not be engaging, quite lethargic. And in some children, they may have apnea, what we call apnea, meaning that pausing during their breathing,
Right.
So what I would advise to parents is that if the symptoms are worsening,
Right.
and also if problems with breathing and child is not eating or drinking, you need to seek urgent medical attention.
Right.
Okay.
Right. Okay, that's very interesting. But the other one is a code. They call it triple threat. And one is wondering, is there anything to worry about? Because this is a language that's been heard now around the health sector, the health officials. And we just want to know, is it another kind of COVID? What is it about? Tell us.
I can understand definitely why people are apprehensive.
A lot
and
of
worried.
anxiety.
I know, I can understand that. I mean, COVID is still in the background. People are still testing positive to COVID.
Oh, really?
And we are now in the flu season. In fact, I was reading the reports, the Health Canada weekly influenza report. They were monitoring the trend of the flu virus activity, and they noted that it's trending above the expected level typical at this time of the year, therefore indicating a start of influenza, which is flu epidemic.
Right.
On top of that, you add the surge of the RSV, so hence the triple threat, right?
Yeah.
Well, it's not all doom and gloom. Thankfully, 2 out of the 3 respiratory viruses, we have vaccines for them, right?
Okay.
That's why I'm trying to encourage everyone to get their flu shot. You can get that via your family doctor or any local pharmacy that is close to you.
All right.
Then second thing is update your COVID-19 vaccination, especially if you've not had any COVID vaccination in the last 6 months or any booster shot. Please do. This is the best time to get it.
Right. Well, I mean, this is a lot of revelation to me, but on a final note, they say health is wealth, and I want you to speak to it. How can members of our community, the African community here in Nova Scotia, how can they embrace wellness at the same time while they have fun and do all manner of things, even at this season? Tell us.
Absolutely. Well, I would just say look after yourself, but what does looking after yourself really mean? First of all, I would say eat right, eat well. Not every food is good for you, you know. That I would advise, cut down on, we Africans tend to on salt.
Okay.
Cut down on your salt, cut down on your oil, cut down on your sugar. And also add in fruit and vegetables, your whole grains, because the food we eat provide the nutrients and the minerals which helps to build our immune system. And it's that immunity that helps us to fight against viruses and germs. So eating well is what I would advise. The second thing is physical activity.
Okay.
It helps to build our immune system as well, and also it reduces stress and anxiety and improves sleep. Okay. The third thing is smoking cessation. If you're currently a smoker, respiratory viruses, they tend to cause cough, wheezing, and shortness of breath. So if you're a smoker, obviously that would predispose you, right? So the best thing I would advise is smoking cessation. The final thing is we're in the festive season. There's lots of merriment. We're going to increase our alcohol intake. So I would advise reduce your alcohol intake as well. And on the final note as well, if you are in the at-risk category, and you have underlying health condition or weakened immunity, I would advise that, because most of the celebrations will be indoors, in confined spaces, I would advise that in as much as we don't have the mask mandate, I would recommend that you wear a mask. That tends to protect you better.
Right.
Okay.
Come on. I mean, this is the best I've had in a long while. The kind of education we have today here will help us indeed. Thank you for coming for the show again.
Thank you for having me.
And there you have it. I've been talking to Dr. Agnes Chinelo-Iwegbu. Don't forget to send your questions or inquiries to communityupdateNS@gmail.com. And if you haven't subscribed to this channel yet, what are you waiting for? You can do that right now and get notified when we upload new content. And thank you again for joining us. I'll see you soon.